Hello, everyone. Welcome to the August 24th, 2021 meeting of the Williamsburg Area School District Board of Directors. Start today with the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, roll call, please, Mrs. Kuzer.
Okay. Mrs. Bechtel?
Here.
Mrs. Zimmerman?
Here.
Mrs. Streit?
Here.
Dr. Royer?
Morning.
Mr. McDonald?
Here.
Mrs. Miles?
Here.
Mr. Wengert?
Here.
Mrs. Sullivan?
Here.
And Mrs. Harold?
Here, thank you. Okay, on to the agenda. We don't have any changes to what you're looking at. So do we have a motion to approve?
So approved.
Second.
All those in favor, please say aye.
Aye.
Any opposed? Okay, on to the minutes. Anybody have any? Let's have a motion to approve, please.
Second.
Any questions or problems with the minutes? All those in favor, please say aye.
Aye.
Any opposed? Okay, Dr. Klein.
All right, just want to give you an update on our virus issues, pandemic issues that officially, since we've had some events taking place, we've had one positive case that counts that we have to count and report, a student at the high school. So we have one case at this time. And I want to make sure everybody understands is that we are currently, all of our schools are equipped with the interior COVID test. It's a swab just inside the nose. It's not the invasive one, but they are available on a voluntary basis if parents or adults would like to be tested. It does take 24 to 48 hours to get the results back. However, we also, in working with the group that we're working with through the Department of Defense, they did say if they see spikes or we have clusters of cases, they would try to supply the rapid test for us. We are also working at this time with some other groups through the state to get rapid tests so we can get a quick turnaround so we don't have to send every kid home that may have an allergy or something like that. We can hopefully keep them in school if they test negative. So we have that going. We're working with, some of the groups we worked with before to provide opportunities for our staff. They had booster shots. And so we are doing that. Anyone else that would want those. And one other note, we got notice that we have another pre-K counts class. We just got our $140,000 into the district for another 17 kids for pre-kindergarten. And so we're somewhere in 130, 40 students in those classes, 8 of them.
Where's the new class?
It is actually going to be at the YMCA. So that we were going to have one there. We have, we'll have some at the high school and I think Maori and I forget. Pardon? Yes, that's right. Waynesboro daycare. But I was thinking we had another one at Fair. No, maybe we don't have one at Fairview, but we have 8 of them. So I wanted to report we did get one more.
Great. Okay, thank you. Okay, it's time for public comment. Please, as always, please give your name and address. Please be sure you are a member of the Williamsburg Area School District location wise. If not, just so everybody knows, you would have to ask for permission to speak, which could or could not be granted depending on the will of the board. So you have 5 minutes. Would anybody like to speak today?
Thanks for having me yet again. My name is Cassandra Ward, Homewood Avenue. And I had a few topics today. First, I wanted to discuss as far as the masking rules with children on buses. And I believe there's a law in PA that says that interfering with the breathing of children is technically considered child abuse. So I'm not sure if that's really a fight we want to take on. I have a copy of that. And with that being said, the quarantine policy, I was at the high school during orientation the first night. And it was talked about that if you have a vaccination, your quarantine may either be less than those unvaccinated if you're exposed or not at all. To me, that's just incentivizing children to be vaccinated, whether they want to or not, because this is eventually going to affect their schedules when it comes to sports or clubs or anything like that that they participate in. So one child that's not vaccinated is going to have to quarantine for 10 to 14 days, or somebody they may have been with that was exposed as well, but because they have the vaccine, they're not going to have to. It doesn't make sense. We all know that vaccination status doesn't matter when it comes to spreading this disease, this virus, as I might say. You can be vaccinated and still spread it. There's even evidence out there that had been released that sometimes the viral load is higher if you're vaccinated. So it does no good to have different quarantine policies for different students. That's going down a trend of discrimination based on personal medical choices. And I don't see where that's fair to these students either. Also, it's showing that schools are still calling parents to let them know when their child's going into a certain grade, certain vaccinations that they're required. Didn't you say at the last meeting that there's no requirement as long as you have your exemption form? I'm not sure.
I don't remember
Yeah, I
that
don't-
discussion, but
Okay, well, if we're going to be telling parents that these are required vaccines that their children need, they should also be informed that there is an exemption form, whether it be on medical values, practical values, and it should be posted somewhere they can easily get to it. That way they know their informed consent, something that they have access to where you're not just getting phone calls, oh, your child needs this vaccine or they can't come to school. And that goes across the board. I've heard even at the high school orientation, it's 12th graders are required a meningococcal meningitis shot, I believe. But if you opt out of that due to religious or practical beliefs, that should be also given to parents as information, or they can't make an informed consent. And then the other thing I wanted to talk about was on the CRT issue. You said that, of course, it's not in, and we get that. But there are times where curriculum is not always a solid foundation necessarily, because not everybody's teaching the same things. I have an example. I believe Mr. Taylor, you saw this from me last year. It's a meme, a picture of Christopher Columbus, and it's got the wording, "They call me Mr. Steal Yo Land." Now, this was on an assignment about explorers from all over the world, Spain, Portugal, everywhere. They all had pictures of these explorers. This was the only one that had anything derogatory in it. That's not okay. There was also a video about, and I have the correspondence between all that. If you guys, I don't have it with me, but I can print it and give it to you. There was also a YouTube video they were supposed to watch about Native Americans and how they were portrayed in Hollywood, and about whitewashing, and about how people of color are held back, and what happens when white people are in power. Now, we all know our children look up to athletes, celebrities, people in Hollywood. So if they're telling them this and you're only getting a one-sided view, and you're not getting an attempt for them to be able to talk about it or refute evidence or discuss different areas, they're only getting that one-sided bias. And I know that's not your intent. I don't think that you want that to happen. But I do think this is an example of how certain assignments can slip through the cracks when there's not checking between teachers as to, well, this teacher actually made the assignment, but I distributed it to my kids without checking it first, because that was said as well. Yep, I gave it to you as an assignment, but I didn't check it.
okay, thank you. And I did say last week or 2 weeks ago that if you have examples, I appreciate you bringing that forward. Sounds like you did talk to Mr. Taylor about that last year. We can follow up with that and find out more about that. So
I have a copy of the photo if you guys want it. I believe Kelly had printed it to where you guys can each have a copy if you like.
Okay. I mean, I believe you just showed it.
I
so,
know,
Yeah,
I
yeah,
just-
okay.
I didn't know if you guys wanted.
Okay. Okay. Thank you. Yeah. Yeah.
I
Go ahead,
just want
Dr.
to make sure that the board understands, we have no requirements of quarantining at all. There are none. So the only quarantine that is done, we call isolation, is if there's a positive case. And that is, that person is isolated. We do recommend people, if they want to keep their child home, they're welcome to keep a child home. And we are also recommending that if they are exposed, that they wear a mask for 14 days in school. But other than that, well, there is no recommend or any enforced quarantine.
Thank you. Anyone else like to speak tonight?
My name is Kelly McGuire and I'm from Sheffield Manor Boulevard in Waynesboro. I just have a request as far as the agenda goes. There's a group of parents that really want to be active in our students' lives, and we want to make sure that we're not wasting their time and our time also. So I was wondering if we can have the agenda for tonight, the board meetings, printed sooner than the day of. That way we can do our proper looking around and making and see what we want to speak about to make sure it is on topic so that maybe it can be addressed or whatever, so that we're not, because today's was supposed to today. So it's hard to look around and see what's going on when we have our own things going on too. So I just really want to be interactive and in the school and that sort of stuff. I always have been on sidelines with my girls, but I just want to see if that's possible to have it printed. At
Okay.
least maybe like Friday or before.
Okay. Thank you. Okay, well, at least try for Monday. They'll give you a day anyway.
Hi, Sarahpence, 14728 Honeydale Road here in Waynesboro. Dr. Klein, you just mentioned about no quarantine. Maybe I can email you at another time because I have the health and safety plan, and that was one of my questions, was about quarantining not required for anyone vaccinated. And then I also went on the Waynesboro district site to look up the definitions of quarantine and isolation. So maybe there's a way we could further clarify that somewhere in the plan, because it was a little confusing to me too. And it's like all here in yellow. So it seems like a discrimination issue, and just would like to further clarify that at some point. The other thing I was concerned about is on the health and safety plan, when there is an exposure to coronavirus, it is stated in the plan that cleaning with Clorox 360 and other practices during the 2020-2021 school year will be followed. This is concerning and it's not very specific. For me, the bigger question is, do we have enough janitorial staff, cleaning staff ready to go for this school year? I'm concerned because I learned that there was a big problem at the high school and the facilities maintaining an appropriate level of cleanliness. I'll follow up with some examples. I was told that by some staff in the high school that the classroom floors were not properly cleaned on multiple occasions. And when asked, we're told the floors weren't a priority because of staffing shortages, high turnover, and janitorial subs just not being as efficient. And the staff were purposefully setting traps by dropping things like glitter or paper in certain areas to see how long it would be there, because they did understand that maybe the floors are not as a high priority area. And this also went on for at least 2 weeks in one account. So again, I was made of another example that the bathrooms were frequently very low or out of hand soap on multiple occasions. And when the staff were asked, there was responses about finding other ways, and the staff decided that they were going to alternate and rotate bringing soap. So at least there was some soap, if nothing else. And I thought we had a grant designated for cleaning purposes, if I'm not mistaken. I know we had PPE grant. We're probably getting more funding this year, especially for COVID swabs and everything. So I'm a little concerned about that because we had so many cases of the athletes
COVID went through the high school, and because I had heard that the gym wasn't even cleaned or the wrestling mats weren't cleaned as often as they usually are because we didn't have money in the staff. And that's shocking because this school year is just set up to fail again for more cases. And I think we can all agree, masks aside, that washing our hands with soap and water and proper cleaning is the best way. And I supported our taxes being raised because I know that you guys work very hard and it is hard to find staff and we want to be competitive. So I support that. I just want to make sure, regardless of the mask debate, that we have properly clean facilities because that is the most important thing to keep our kids safe, having soap, washing their hands. And I just wanted to also point out, there was some information that came out from the senators, 8 senators directed to school superintendents and board presidents yesterday, recommending and urging mask freedoms. Thank you for allowing that so far for us. I hope if the numbers, not if, when the numbers go up, you guys will remember cloth masks, don't keep out COVID-19 particle size. We've already discussed that. I'm not going to beat a dead horse. Please remember, parents, we just want our kids to breathe safely, to not feel pressured to wear a mask, okay? And the bus issue is still a concern for me. I hope you can vote to drop the masks on the buses. It's not a federal law. I can give you that information afterwards.
Thank you. Anyone else like to speak tonight?
I tend to be right up to the minute. So I got a timer. There we go. Well, this is, I got this big long speech here. And then,
Can we do name and address again?
oh,
Sorry.
I'm sorry.
Sorry.
Margie Schaeffer, 13593 Monterey Lane in Blue Ridge Summit, PA. And I had this big long speech, but then now I'm hearing the quarantine is going to be to wear a mask if you are sitting within 6 feet of someone for 2 weeks. Is that right? Is that what I heard? Is that required?
It's if you've been exposed to a positive case, the
Right.
recommendation is you wear a mask.
And what is the diagnostic tool used for determining a positive case? Is that the PCR test that the WHO?
Positive test that's reported to the school.
Yeah, they're still using the PCR test that has been said it's totally a defunct test by the CDC and the World Health Organization. And as in January, they're going to have the new test that will designate if it's the flu or COVID, SARS-2. So why are we still using this test that's thrown all these false positives? And the reason I'm saying this because the experience I had with my grandson as a 6-year-old in first grade last year, sitting within 6 feet of someone on the bus, and he lives with me, as you know, we have shared apartments in our big building up there. So I watched him for 14 days and his mother do online schooling for 6 to 7 hours a day. He's 6 years old. He was tormented, as was his mother, and it was me watching this. And then a couple times I had to try to figure out that system. Well, that's something else. We won't go into that. As an educator, and I know I've been an educator for 45 years, but abstract thinking doesn't even begin till a child's 9 years old. They're kinesthetic learners. I can't have this happening again. Now, it sounds like it's not going to, but who knows where this is going to go. And I just wanted to get that out there. I'm not on board with that. Politics and medicine do not belong in education. I'm so glad I'm retired. if a kid is sick, they need to go to their doctor. And they need to be diagnosed and they need to get their, their slip from the doctor. And then the other kids, they're not sick. My grandson was totally asymptomatic all 14 days. So it's like, what happened to those good old days? Why are we not teaching? Why are we bowing down to fear and panic that it creates? I mean, these children, I just printed these out. My second granddaughter is 6 months old. Children born during pandemic show lower cognitive scores. Children born during pandemic have lower IQs. US study finds. Do you know how much lower? 30 points. The usual for up to 3 years old, from 3 months to 3 years old, is 100 IQ. They're 70 now. They're testing 70. These are the kids that you're going to have soon. Oh my gosh. I mean, unbelievable. The social application here. It's unbelievable. And my grandson last year is the only child, so he needs school. He needs it badly. So I just ask that you consider all that. And I want to say one more thing since I've got 43 seconds. 10 seconds. This is a graph that shows you that all diseases, including this pandemic, herd immunity is the best. Before the vaccines were introduced, they were null, negligent, gone, basically. So,
Thank you. Anybody else tonight? Okay. Oh.
Shorter side. Lord. I'm Susan Wolf, 12246 Polktown Road, Waynesboro. Just a question, or maybe you could clarify, Dr. Klein, when you were talking at the beginning about an anterior COVID test and it being voluntary, when are they used and who gives the okay to do that?
The test is, the supplies are available at each school. All of our nurses have been trained, but it is only if the parents would like to have a child tested. So if there's a suspicion they're sick, instead of going home and parents saying, we're not going to have them tested, whatever, and the kid's out for 10 days, they may say, maybe we can get them tested, find out they can go back sooner. But the anterior test is, again, through the Department of Defense that we are able to get through their supplier. And it's just right inside the nostril. And it's a lot less intrusive. But it would be by parental permission, or if an adult wants it done, that would be up to them. It's all volunteer, like the masks, vaccination. We have left it to choice.
Okay, and just another comment. When you're talking about the quarantine and people who have the vaccine or vaccinated, I know everybody here watches television and you've seen on the news, even Pelosi's aide had the vaccine and still got COVID. So if you're saying that they don't need to quarantine or maybe don't have to quarantine as long, those people can transmit this. So they're no different than somebody who has not gotten the vaccine and could still transmit a disease. Just want to clarify that it's been happening all over the United States for months. So we can't turn a blind eye to it and treat these people as if, oh, they've got the vaccine. They're not going to give it to anybody.
Everyone has a choice, whether they've been vaccinated or not.
Oh, I understand that. I'm just saying about the quarantining part of it. Does not make sense the way you're saying that somebody who has already gotten the vaccine maybe won't have to quarantine at all. And that just doesn't make sense.
If they come back positive, they have to quarantine.
Okay. Just wanted to clarify.
No, it was only, and I have to distinguish, and usually at least through the people we've worked with the state, if somebody's positive, they consider that an isolation. If it's someone who's being quarantined, it's just a close contact. But in any case, there's no one being required to be quarantined unless they are positive, or that there's a suspicion they're positive until they get tested or it's proven that they aren't. That they'll be isolated from school.
Okay, so last year, my son, we were called by Mr. Pappas that somebody in one of his classes came positive, and they called and he had to quarantine for 14 days. They didn't say anything about being tested, see if he was negative. He just had to stay home because he was in this classroom with the kid.
Last year was different than
Yeah.
this year.
Okay,
And our data does not show any positives past 14 days that we have had. And most of those 14 days of people that are kids or other staff members, they were positive, but if they became positive because they were exposed to someone, it was usually in the home or outside of school. That's what we have found. Very little had been transmitted in school, if any.
I had COVID last October, and my 2 kids and my husband, of course, lived there and were around me, and none of them got it. So I'm just saying,
I was in the
it doesn't
same room with
always-
2 people that were positive, and I didn't.
yeah. Thank you.
Thank you. Anyone else? Okay, if not, then we will move on to board initiatives, board reports. Do we have any reports from anyone? At least maybe Miss Smiles or Miss Spector who were at the house ribbon cutting.
If you didn't have the opportunity to be at Alma's beneficial house ribbon cutting today, you missed a wonderful time. There was students there that are going to be going there to school this year. There was parents, there was people that had volunteered their time and money to make that house complete. It was absolutely wonderful. And I want to thank our special needs teachers and administrators for a wonderful job they did in doing this, and also Mrs. and Dr. Royer. She was the guiding force behind this. So I got tears in my eyes, if you want to know the truth. It was
Right.
that wonderful.
So did I.
Yeah. Kim was there with me.
Okay, thank you. Any other reports from anybody? I'm not sure we had any committee meetings last in between. Okay. New agenda item. What does
I'm not
that mean,
sure what
Dr.
that
Vine?
is. There's no new agenda.
No new agenda item. That's a mystery. Okay.
Those are the best kind.
Okay.
I think that was from last time.
I'm not sure what that was. Okay. Mr. Taylor is going to talk about the whole child.
Good evening. First of all, I'd like to thank everyone for an opportunity to talk to you this evening, give an update basically where we are with First Choice with our whole child pillar and initiative within the district. I'd like to first start out and really thank the people that I've been working with in the district. We have about 10 to 12 teachers, administrators across the district that we've been working since last April. And they have been fantastic to work with. And I had an opportunity to talk about this twice today to the staff in the district. And I wanted just to make sure that I've echoed that again, is that this has been very much a team approach. And I really believe that's why we're having so much success so far with the progress that we've had. So Nick, if you could go into the next slide. So basically, one of the things I really want to focus on tonight is really talking about the purpose of our whole child initiative within the district and what that really means. So basically what we're looking to do is to really give our students the skills that we believe are important for beyond school, into their life, into their career, and can be utilized at school. And as I said today, I think a lot of us could probably argue that some of these whole child skills maybe are possibly as equal, if not more important than some of the academic skills that we're teaching through today. So some of these skills are self-awareness skills, our students understanding basically what their emotions are, how to basically employ some of those coping strategies that we're teaching them, being able to have self-control, once again, utilizing some of those skills that we're teaching when they're upset, when they're angry during not only their school day, but in their life. And also some of those interpersonal skills that we know that are important as they're working with others, not only in school and groups, but also outside of school. So we're really excited about the opportunity to continue to teach some of our students some of these skills so that once again, that they're having success K to 12, but they're also having success as they move past into their post-secondary careers, into the workforce, but just into their general life that they're going to be experiencing past washes. Nick, if you go to the next slide. So basically what we wanted to do is we wanted to actually embed not only what we've believed in Waynesboro that we wanted to teach our students from a whole child approach, but we wanted to make sure that we are looking at some research-based programming across the curriculum that we're looking to put in place. So we utilize two different research-based programs. One is actually developed by an organization called CASTLE, which stands for Collaborative for Academic, Social, and Emotional Learning. So really the goal here is to ensure that we're not just creating a program on Waynesboro thoughts and ideas, but really looking at our whole child and ensuring that we're teaching all those skills that we believe are important for our students to be successful. So what CASTLE does is they break down the whole child approach into 5 different categories. There's self-awareness, once again, understanding what our students are feeling or experiencing. Responsible decision-making, basically trying to teach our students when they're making decisions, how can we take information so that we're making responsible decisions to have greater success when doing so. Relationship skills, obviously how they're getting along with others. Social awareness, once again, understanding what their role is within situations that are not only just going on in their classroom, but going on outside of that. And then also finally, self-management. So once again, understanding what their emotions are and being able to manage those and being able to use some of those strategies that we've taught them. In addition to that, Nick, if you can go on to the next slide, not only we're utilizing the CASTLE framework, but we're also utilizing the 16 habits of mind. The reason I really like the 16 habits of mind and the committee we're working with really wanted to focus on this aspect is it really takes those 5 categories from CASTLE and breaks it down into 6 healthy habits. I know it's sort of hard to see up on the TV up there, but basically what it's doing is it's breaking each of those 5 categories down into individual skills that are easier to see or be defined, that we can ensure that within the curriculum that we're going to deploy to our students or teach to our students is ensuring that the student has been taught all those skills that they're going to be to help them be successful in the future. Some of them, for example, is the last 9 years being at the middle school, we were constantly talking about how our students are not able to persist through like a math problem, for example. They get to a math problem, they stumble, it's hard for them. So instead of actually persisting and knowing how to ask for help or work through that situation, a lot of times they shut down and don't do that. So one of the examples on there is the number 1 habit of mind is, or not number 1, but the first one on the list is persisting. Being able to work through a problem and continuing to have some resiliency, being able to, once again, ask for help, utilize some of those skills that we're trying to teach our students, and being able to work through a problem and work through and be able to have success doing that. Some of the other ones on there are even things like finding humor. So when they're struggling and having a difficult time, being able to utilize some of those strategies to be able to work through that so that they don't become over frustrated and are able to have some success. Thinking flexibly, managing impulsivity are just some other examples that we will be attempting to teach our students within our curriculum. Nick, if you want to go on to the next slide. So when we started meeting actually in April as a committee, we wanted to make sure that we came up with our core principles that we felt were important as we started on this whole journey. So as a committee of educators, we basically came up with 6 different principles that we believed we wanted to use as a guiding tool to decisions that we are going to utilize moving forward. So number 1, we felt like we needed to develop a strong tier 1 curriculum, otherwise known as our core curriculum or core instruction. So basically what every one of our students was going to receive. So once again, as our students leave each grade level, we would have an understanding if they've been taught the skills and if they've been assessed as they move throughout that grade level. We also believe that we needed to have some screening tools that were going to be easy and effective and efficient to be able to implement so that our teachers weren't spending a lot of time putting another screener into place. It was taking time for their academic instruction. We believe that they needed to be online so that they're able to make that more effective and efficient so we could gain that data back on each individual child. We believe that not only did we need that universal screener data, but also additional learner data that was able to personalize each approach from a whole child for each one of our students so we could focus on where some of those strengths and weaknesses were for each one of our learners. We also felt it was really important that the lessons that we were going to teach were going to be digital. So if we did end up in a situation like last year where we had to go virtual, we would be able to still utilize the program that we had chosen. And we were going to be able to integrate that into with some of our instruction that was already virtual already. So, or some of our students who were living in a virtual world by choice. So we wanted to make sure those lessons were digital for that reason. We also believed in order, once again, to not take more time away from our academic instruction, we wanted to make sure that we chose a model that was going to have short and concise lessons so that we were focusing on the lesson and not taking a lot of time from other items. And finally, the last thing is we really believe was important was being able to develop some professional development to help our teachers to incorporate what we are teaching into their everyday integration in their instruction so that we could take advantage of some of those teachable moments that we know are important after we've been taught something so that it's not just taught in isolation, but it was going to be able to be utilized in a real life situation. So those are the 6 principles, pillars of whole child that we really thought were important to be able to guide us and make decisions as we were moving forward. Nick, if you want to go to the next slide, please. So back in June, we met as a committee and we basically held an opportunity for all the people in the committee and anyone else that was interested to basically get an opportunity to see a bunch of different vendors that were going to allow us to incorporate that core instruction within our district. So after we had an opportunity, I think it was 8 or 9 vendors that we had an opportunity of seeing. It was pretty much overwhelming the choice of the committee that Suite 360, one of the vendors that we saw that day, would be the vendor of choice. For a lot of those reasons, back to those principles that we were talking about, it was going to allow us to accomplish all of those. It's online, it's virtual. Basically, there's a library of thousands of different lessons that once again are based on the CASEL different categories I talked about earlier that we could roll out to our students. They're short and concise lessons. There's a universal screener. There's also a data warehouse for each one of our individual learners to tell us who's completed what lesson, how well they're doing on those lessons, and then even some more detailed information on some of the feedback they've given about themselves and some of their experiences and feelings as they grow throughout the year. One of the other things that I really like about the program that and the committee thought was really important is there's lots of conversations about what's being taught to our students. So parents would have the opportunity to be able to see. There's also a parent component of this. So the lessons that are being taught to our students would also be sent out to our parents through a parent portal, very much similar to the student one you're seeing. So they could actually log on and see the lesson and the material that was taught to their students. So not only will the students see, like I used an example today about cyberbullying, obviously from being at the middle school, having some online types of issues with students here and there, which was something that we focused on for some of our lessons in the past. So we would be able to deploy that lesson to our students. They would watch it during the day. Then we would be able to share the actual login with our parents. They would be able to go on and also watch that same lesson. So they would be aware of what was being taught to their students. So it would clear up any kind of controversy with that. Also, in addition, there's a couple different tools with this program. Also, we would be able to roll this out to some of our students that are in alternative instruction, otherwise not as in-school suspension or out-of-school suspension, so we could focus possibly on some of the reasons why they were in those suspensions, so that we can make sure that they're learning the skills that they need to be able to return back to school and be able to not have those same similar infractions in the future. So as we roll this out in late October, early November, the program that we'll be training our staff on, it will be launching out to or introducing to our parents will be Suite 360. So everyone is aware of what that program is. I'm going to go to the next slide. So just to give you an example, I know once again on the TV it's very difficult to see. Basically, what we did in July was we started to begin on developing our curriculum K-12 in the district. So one of the questions I answered today for the staff is we're not looking to replace Project Team at the elementary or any of the work that Mrs. Nemzik actually has done in kindergarten with Mr. Rogers and some of the other curriculums already been developed. Our goal is to embed this curriculum along with that So we're making sure that we're teaching our students all the same skills. And then once again, making sure as they're leaving some of those primary grades with all the skills that they need to have as they move into the intermediate grades and primary, past the primary grades. So basically on this curriculum document, once again, I apologize, it's hard to see up there. Basically, this is a 6th grade document. What we basically, our process was first identifying in Waynesboro, what do we believe were those non-negotiables as a 6th grade or a 1st grader or even a senior? What are those non-negotiables that we believe by the time that student finishes that grade, they should be able to do from a whole child perspective? Then we connected those to the CASTLE framework, those 5 concepts. Then we, even in addition to that, we connected them to the 16 habits of mind. So once again, ensuring that we're looking at that whole child and making sure that they're learning all the necessary skills as they move throughout the year. And then the last thing we did is we connected that to the Suite 360 lessons, which are all listed on the right hand. Those are the actual lessons that would be taught to our students. So what would happen is at the beginning of the year, I use Dr. McCallum as an example with the high school. She basically would take the lessons for all of her students per grade level. She would roll those out and push those out to her students. So they'd already be done. So the teacher would not have to do anything additional. That would be done by someone at the admin level. Then all the students would have to do was actually, when a teacher asked them to do so, is log into Suite 360. The lesson would be there. They would simply click on it, and then they would actually complete the lesson that was assigned to them, which are the lessons, once again, on this document. Some of those lessons are focused on things like once again, such as working as a team, being able to work through peer conflict. Some of them are, once again, like other interpersonal skills. Some of it's goal setting, how to set a goal, work towards that. All kinds of different, once again, different skills based on those 16 habits of mind or those CASTLE 5 domains. So once again, each of our grade levels has a document that's dedicated. We'd be teaching 2 lessons per month that we would ask the staff to implement throughout the year. Our goal was, once again, is to do this at late October, early November, just because we didn't want to overwhelm the staff or the students as they returned back from a difficult year last year. We wanted to get back into school and working before implementing something else. Can we go to the next slide? So next steps. So one of the biggest things that we want to do is in the future, as we continue to work as a committee, is begin to develop what we refer to as an MTSS framework, or a multi-tiered system of support. What that basically the framework consists of is a tier 1 initiative that we're teaching all of our students. So that's the curriculum that you just saw up there for 6th grade. For example, every one of our students will get that tier 1, that core instruction. Tier 2 is more of a targeted intervention for our students. So that would be looking at students who are struggling still with some types of behavior in the building. So we would identify them through things such as office infractions, other things that as we go through with teaching the core instruction, we would see that they're still struggling in certain areas. And then we would put some targeted interventions in place to help reinforce some of those skills that they need some additional instruction on. And then tier 3 would be some of those more intensive supports we have in the building. For example, our Inspire classrooms or our Boost program that we're launching this year. So it's more intensive for our students who really need that tier 3 types of support that are struggling from a behavior standpoint. And we want to make sure that we're giving them the support that they would need to be successful. So as we continue to move, we're going to give more professional development for our staff. And before we launch Suite 360, once again, in late October, early November, we're going to continue to create that MTSS framework for behavior within the school district. We're going to continue to give some professional development on helping our staff integrate that daily instruction or integrate whole child instruction into those teachable moments within their classroom. And the last thing that we're going to do here in the middle of September is we're going to work with the IU. Dr. Sterner-Hein and I are going to be working with the IU to roll out a survey to all of our staff to really try to look for where some of those climate issues may be within our district. Not saying we're going to fix every climate issue within the district, but our goal is to address them and come up with a plan of how we can improve upon those things within the district. Nick, you want to go to the next slide? Last slide is questions. Any questions that I could answer for anyone?
Okay. Okay.
All right.
Thank you, Mr. Taylor. Okay. Moving on to the business portion of the meeting, Dr. Sterner Hein and personnel.
All right, I'd like to direct your attention to the information listed in personnel. We have reassignment of professional staff, reassignment of support staff, some salary column adjustments for professional staff, new assignments and stipend payment for support staff, appointment of support staff, continuation of the appointment of support staff, appointments of extracurricular staff, a continuation with another personnel handout, resignation of support staff, appointments of support staff, appointments of coaching staff. And then finally, I have a listing of several professional appointments. Stephanie Kelly, Kendra Zaruba, Michaela Yili, Gabby Chris, Carrie Ripacek, Gabby Gabrielson, I'm sorry, Chelsea Gabrielson, Patricia Klein, and Brianna Kaufman. Recommendation is to approve as listed.
Motion to approve.
So moved.
Second.
Questions for Dr. Sterner Hein? If not, all those in favor, please say aye.
Aye.
Any opposed? Okay, staffing lists, Dr. Sterner Hein.
All right, so the next is the listing of both professional as well as additional building staff that were identified as of today, recognizing that individuals within this personnel listing may or may not be included in the listing. So that is the completion of a summer worth of interviewing and working through the process. So we are fully staffed, I believe, at least from a professional perspective, with the addition of one teacher at the senior high school. So very grateful for my administrative team for working through in the interview process, as well as individuals here at Clayton Avenue, especially Sharon Levick. She has been a very busy lady the last couple weeks. So
Did you say there was a hire at the high school? Or it's a temporary?
It's there is going to be a recommendation pending reference checks.
Okay,
So,
great. Okay, do we have a motion? Are we approving these? Okay, yeah, yes, we are. We have a motion?
So moved.
Second.
Any other questions? Anyone? All those in favor, please say aye.
Aye.
Aye. Any opposed? Okay, Special Olympics MOU. Who is that? Is that you, Dr. Klein,
Yeah,
Mr. Holtzman?
I believe it's one that we've had before in the past, but it's basically an agreement. I believe, I'm pretty sure it's an annual MOU, just an agreement to do Special Olympics and our students going to participate.
Motion?
Move to approve. Second.
Questions, anybody? All those in favor, please say aye.
Aye.
Aye. Any opposed? Thank you. An ESS counselor addendum. Who would that be?
I can-
Okay.
So ESS is the company that we utilize in order to secure our substitutes. And just this year, I found out that it did not entail the use of guidance counselor substitutes, and we were able to secure one of our retirees at this point who is filling in as an ESS counselor substitute for a counselor on maternity leave. So this is just simply suggesting that we are adding counselors as an option. So maybe during the course of that school year, if that counselor would like to come back in that capacity, they're able to do this. Currently, our contract is for teachers only. So this would just add counselors as an option.
Could we have just hired them ourselves?
Probably not, since we are actually in an agreement with yes.
When does
our agreement with ESS end?
We have one more year. The county is looking at it as a group. The problem is we have 5 districts that are using them. If one pulls out completely, you're going to be scrambling to find anybody that's not connected with ESS. So it's almost a monopoly when they do it. If we do not go with ESS, we're on a temporary basis trying to figure out, can they make some improvements here? But if we all choose to not do that, then we could go back to doing our own or choose another contractor.
Is there another contractor in the area?
Well, there are some in the state. There are a couple of others. There are even some districts use Kelly That's been one that's been used before. There are others. I know in other districts I've been in, we use different ones than this one. But this is the one that kind of came here at first. But it is right now only 1 year because we want to see if some improvements will be made
So this is the last year
this
that
coming
we're
year.
under contract.
Yeah, actually, we're starting in the fall to start looking at other options.
Do you have a motion to approve?
So moved.
Do you have any other questions?
I have a question.
Okay.
So when I read this, I thought, oh, do we get a sub for guidance counselor for a day? I mean, however, the way you explained it, it's not going to be that way.
No, my apology. In this
It's
particular,
okay.
we do not get a counselor for a counselor who's out for a sick day. This is a counselor who's on a maternity leave.
And
And
that
so,
is
and it's an
totally
extended
different.
period of time.
And this is even a counselor who is familiar with the job. I couldn't imagine a counselor coming in for a day.
No.
and fulfilling any.
No, thank you for
responsibility.
clarifying that. That
Okay.
is correct. It's for an extended period of
Thanks.
time.
And one of the advantages of having a company like ESS, if you have a retired person, if we went to hire them, they're going to have an issue with their retirement with visas with the state. So if they go through ESS, they're going through a private company that they don't have to worry about that.
Okay, everybody's good? All those in favor, please say aye.
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 Any opposed? Okay, on to a transfer of the fund balance. Mr. Holtzman.
Yes, ma'am. Thank you. We have an old retirement incentive. I think we've talked about this. We usually look at this about once a year. That benefit stopped as of 2013, but the employees that are still here receive that benefit whenever they retire. So as they retire, we want to reduce so to speak, the fund balance that we have out there for them. Years ago, I think 6 years ago, we had about $600,000 out there. Now we only need about $296,000 to kind of fulfill that obligation. So what we're asking to do is just to move $38,000 over. Really, we're just taking it from a committed to unassigned. So we're not doing anything with the money. We've already put the money out the door, that $38,000. We're just asking to move it over.
Okay, motion to approve.
Second.
Questions? All those in favor, please say aye.
Aye.
Okay, on to the business, or the financial business, that is. Mr. Holtzman.
Thank you. We have for your review and action, we have the cafeteria and general fund bills, as well as the purchase orders or the positions. And then we also have real estate assessment changes. Those are typically coming from Franklin County Assessment Office. And in this case, it's primarily for a decision by the appeal board, as well as a exempt disabled.
Okay, do we have a motion to approve?
Move to approve. Second.
Questions? Anything for Mr. Holtzman today? All right, all those in favor, please say aye.
Aye.
Any opposed?
Thank you.
Okay, Clayton Cabinet,
No comment?
anything?
I just want to recognize the faculty, staff, administration for 4 successful days of in-service. And tomorrow is our opening day, and we're very super excited. I know the open houses last week were very well attended. Lots of students and families excited to get back to school. So looking forward to an outstanding year.
Good. Board member comments? Nobody? Okay. And now it's time for our second public comment. So if you haven't spoken yet, you'd like to speak, same rules apply. Name and address, 5 minutes, please. Would anyone like to speak? You're really only supposed to speak once unless there's something in the. Well, Dr. Yeah, if you could email that and give you a more thorough response,
Yeah,
maybe, but
I'm glad to respond.
okay,
It's,
go ahead.
I mean, the way we report it, there's only two things that the state's requiring us, and one is the masks on buses. And then the second thing is the state is also saying that we have to report all positive cases. Other than that, that's the only thing we have to do. So those cases that are positive, that count within our numbers, that person was within a building or within a school event at any time, those we have to report to the state. We're not at this time. I am the pandemic coordinator for the district, so I'm the one that will report it. And that goes through my secretary and myself, nurses and all the others. We have a system that it goes, and it worked well last year. And it has to go through me since I'm the pandemic coordinator.
It's a pretty, by this point, well-oiled machine.
Seems like a big job for one person.
It is a big job
It is.
for one
Very
person.
much.
You're hard. You want to talk with you and you know you have a lot on your plate. So it was just maybe going to be a suggestion, maybe like a COVID team. I know that has to come to you for finals, but it was just a way to like how does that take the load off of you?
I'm going to be very honest and upfront of why I decided to do it. And I told some board members that one of the issues with the pandemic coordinator last year is the recommendation of closing schools. And as superintendent, I take that very seriously, whether it's weather or anything. And I knew if there was a group or any other person that would be in charge of the days, they probably would have caved and closed schools many days because of pressure. And even though I lost a lot of weight, a lot of hair, and gained a lot of wrinkles, I wanted to do it because I wanted to keep our kids in school because I felt that was the best place for them.
All right, if there's no one else that would like to speak, do we have a motion to adjourn?
So moved.
Second.
All those in favor, please say aye.
Aye.
Aye. Any opposed? We will be going to executive session, but we will not be coming back.